Hey, Dr. Greg Pat here from PT Made Simple. Today I got a good video for you. We're going to talk about the top 4 exercises you can do to build nice, strong rotator cuff. So rotator cuff problems are probably one of the most common things that we see as a physical therapist. And today I'm going to show you the top 4 exercises you can do to strengthen all 4 muscles of the rotator cuff. So on the board here, I have those 4 muscles of the rotator cuff listed. So you have your supraspinatus, infraspinatus, your teres minor, and your subscapularis. So when you're talking about the rotator cuff, there's 4 muscles that make up the rotator cuff, and it's these 4. So as a group, those 4 muscles surround the head of the humerus or your shoulder, and they kind of provide stability and compress the arm on the shoulder blade and allow the arm to kind of move around. So if you have weakness in the rotator cuff, the arm is maybe moving around a little bit too much, you don't have that stability in the shoulder, and that can lead to impingement, which can lead to fraying of the rotator cuff, partial tears, and possibly even full tears. So very important to kind of have a nice, strong rotator cuff. So when you're looking at the 4 muscles, there's different functions that each of them do. So when you're talking about the supraspinatus muscle, the function of that is called abduction. So that muscle helps to kind of abduct the arm, kind of move the arm up to the side. The infraspinatus and the teres minor, what they do, both of them, is they externally rotate the arm when they contract. And then you have your subscapularis, that internally rotates the arm. So abduction, the arm coming up to the side, external rotation going out to the side, internal rotation pulling in towards you. So again, they kind of work as a force couple when they're working all together, but individually they have different functions that they do. So if you have weakness in your external rotation versus your internal rotation versus your abduction, that can give a clue to physical therapists about what muscle of the rotator cuff could be involved. So I want to show you the top 4 exercises that I like to give my patients for the rotator cuff, and I'm going to kind of go through what muscle it kind of targets as we go. So the first one, I like to have my patient lay on their side. This would be working the left shoulder. I like to put a small towel underneath the arm, kind of keep that compressed. It helps technique, one, but also a little bit of compression will help to increase the EMG, the muscle activity of that. And then what you do is you start with your arm against your stomach, keep that squeezed, and you rotate the arm up in the air. And you can start with no weight, and you can start to add a dumbbell. Again, it's a pretty small muscle, so it does get tiring as you go. So if you do 2 sets of 10, you'll probably start to feel a little bit of a burn in the muscle. So you just want to kind of go. If you can't get all the way up, you just want to kind of go into a comfortable range. You can kind of stop here. You can go all the way up to kind of get the full motion of that arm. So I like to call this sideline external rotation. That would be the first one. The next 2 involve using a TheraBand or a stretchy band, an exercise band of some sort. So normally at home I would have my patients tie it to a doorknob or a pole going up their stairs or down in their basement and loop it around, but just for this video I just kind of tied it onto the treatment table. I like to use that same towel, tucking it underneath. So that sideline external rotation, you can kind of guess, that kind of works the infraspinatus and the teres minor. You will get a little bit of supraspinatus as well, but it's kind of working that externally rotating it. So now standing with a band, towel underneath the arm, now I'm going to work to strengthen my internal rotator, which is my subscapularis. So what you're going to do, keep the stomach kind of core engaged. You're just going to pull your arm in towards your stomach, back out slow. In towards your stomach, back out slow. Again, the towel has two functions. Again, it'll increase that EMG activity, so important to use one, but also kind of work technique, because you don't want to, if I didn't have the towel, you don't want to be pulling like that. You want to keep your forearm pressed right against your side. No towel. People have a habit of going out like that. It's not that. Keeping that squeezed. And again, start 2, 3 sets of 10. And again, if you have bands, usually bands with different resistance, or you could step further out if you need more resistance. So that would be working my left arm internal rotators. I'm going to go back and show you another one for the external rotators, the infraspinatus and the teres minor. I'm just going to show you from my right arm just so you guys can see. So normally if I was going to do my left arm, I would have my back and I would be pulling out, but so you guys can see, I'm going to switch to show you from my right arm. So now you're going to kind of start and you're going to rotate out. Usually this one is harder than pulling in. Your big pec muscles will help on the internal rotation as well. So usually this is harder, but you should kind of feel it work in the back of the shoulder. Again, start with 2 sets of 10. Progress the band as needed. You don't want it to be too heavy where you can't do 2 sets of 10. By that second set, halfway through, you should start to feel like, yeah, I'm getting a good workout. So, 2 sets of 10. This again is going to work the external rotators, keeping that towel underneath. And the last one, what I like to do for the supraspinatus is usually like to have people start with like small 1 to 2 pound dumbbells. I don't have any dumbbells here with me today, but what you want to do is you're not bringing your arm straight forward. You're not bringing your arm out to the side. Think about kind of coming up into like a V. And you're just raising your arms up. Just your hands are about even with your eye and coming down. So this is going to target that supraspinatus muscle, which is usually the most common one that gets torn. It's right on top of the shoulder, kind of comes around, attaches there. So again, go light, work 2 sets of 10, kind of build up the endurance into there. So you may hear this called like a full can exercise. So if you had a full can of soda, you're raising up, as opposed to like an empty can, like you're dumping the can out. And you don't want to do that. That can put stress on the supraspinatus. You want to do a full can. This, or you may hear it called like scaption, either or. So, in summary, these are the 4 muscles. The top 4 exercises are side lying, shoulder external rotation, standing, shoulder internal rotation with the band, standing shoulder external rotation with the band, and then I'm going to call it the full can exercise, where you're kind of in that V position. You're not going all the way up, just to about hands even with the eyes. And if you have any weakness, thing to look out for is you don't want to hike that shoulder up. You want to just go as high as you can without that shoulder elevating. So those 4 exercises will target those 4 muscles, give you a nice bulletproof rotator cuff to prevent any long-term shoulder issues. So hope that helped. If you guys have any questions, comments, just kind of leave those below and we'll kind of keep going. Thanks.